Before we begin, please know that some episodes include language that may be sensitive for some people. Hello, and welcome to another episode of The Birth Portal. My name is Connie. Today's true story is about a woman I'll call Connie. Although this was her second pregnancy, it was her first pregnancy with midwives. Connie and her husband said they absolutely wanted a home birth. Not because they had a negative experience the first time, but they just wanted more control over their experience this time. They listed off their expectations, which were reasonable. Most people that write a birth plan have the same expectations for the most part of what midwifery care offers. All midwives ask is that sometimes circumstances develop that change the couple's plans, and sometimes their expectations can't be met despite all efforts. Their birth plan went something like this. Connie wanted to be able to labor in whatever position she chose. She wanted to be able to eat and drink whatever she wanted, whenever she wanted. They wanted the lights to be dim. They wanted their child to be there with them at the time of birth. Her husband wanted to catch the baby. She did not want an episiotomy done. An episiotomy is where we cut the perineum. That's the skin between the vagina and the anus. That's only done for emergencies. They wanted delayed cord clamping. Again, that's normally done. We wait at least a minute after the baby's birth before cutting the cord, if all is well. They wanted skin-to-skin with mom immediately after the birth. During a third trimester visit, we would discuss at the clinic possible emergency situations and how they would be handled at home. We would also clarify our intentions to follow their birth plan as close as possible and see if they were willing to accept a change of plans in an emergency situation. Connie had an easy pregnancy, except the need to take an iron supplement to increase her hemoglobin to an acceptable level to support a home birth. Hemoglobin carries oxygen and heme. If a woman's levels are below 100, we would recommend a hospital birth. The reason for this is that in childbirth there is blood loss when the placenta comes off the uterine wall, or if mom sustains a tear or needs an episiotomy. A normal amount of blood loss can be up to 0.5 liter. If the woman's hemoglobin is less than 100 and she was to lose 0.5 liter, that could drop her hemoglobin down to about 80 or so. This sometimes causes side effects with women like shortness of breath due to less oxygen available and exhaustion. For some women, it can even impact the production of milk. Women who are symptomatic are offered blood transfusions or iron infusions. Connie went into labor spontaneously 2 days past her due date, with her water breaking first. Labor typically starts before the water breaking, but approximately 10 to 15% rupture first, and 95% of those women go into labor within 24 hours. When I arrived to Connie and Tom's home, the lights are dim, with Christian music playing, and Connie is sitting on a ball, gently bouncing up and down and swirling your hips in a circle through the contractions. When I check her cervix, I see a gush of clear fluid as I apply pressure on the top of the baby's head when assessing how low it is and determining the position that the baby is facing. She's 4 to 5 centimeters dilated, and the baby's head is well applied to the cervix, and the head is also in a great position. The contractions are every 4 to 5 minutes, lasting almost a minute. It is 5 a.m., so Tom makes a pot of coffee as I set up my equipment in their bedroom where they want to deliver the baby. Labor progresses slowly, but steadily, and the baby's heart was perfect. I'm ensuring Connie is well hydrated and voiding or peeing every couple of hours. A full bladder can affect how well the baby's head descends into the pelvis. Imagine a water balloon in the pelvis in front of the baby's head and how that could impact the baby coming down. That's what a full bladder can do. By 9 a.m., Annalie is now contracting every 2 to 3 minutes and is getting tired. But she's made progress and was now 7 to 8 centimeters dilated. So I call my backup midwife to come and join us. By 11:30 in the morning, Annalie is fully dilated, and we all head upstairs to her bedroom. Tom is very excited and immediately goes and washes his hands and puts on a pair of sterile gloves. Annalie chooses to start pushing, standing at the bedside. After about 30 minutes, she's exhausted and decides to lay on the bed to continue to push. The baby is coming, but slowly. And 15 minutes later, the baby's heart rate drops below 100, staying low no matter what position we get her in. It's time to call 911. I explain to Annalie and Tom what is happening and ask her to dig down deep for strength and push as hard as she can. Dad begins to pray, and Annalie pushes with everything she got and delivers the baby's head. I check for a cord around the baby's neck, and there is no cord. The paramedics arrive at this point, and I ask them to stay in the hall for now. Okay, Annalie, give me another push. And the baby doesn't come. I pull down on the head while she pushes, and nothing. I try pulling up, and nothing. Her bed is too soft, and her body is sinking into the mattress. I look around and say, "Hand me the bedpan," and I slide it under her bum and say, "Okay, try again." And it works. The baby comes easily, and I place the baby on Mom's belly, screaming loudly. She only sustained a small tear, and the bleeding is normal, so we say thank you to the paramedics, and they leave. 3 hours later, Annalie and Tom cuddle in bed together with their 3-year-old and their new addition to the family. And the other midwife and I head out to see other families in the community with a big smile on our face. Thank you for joining me for another episode of The Birth Portal.